Well, thank you, Madam Chair. And been following part of this from my office and part running from other things. One, I want to, Secretary Burwell, you've always been available, and I appreciate our talk we had earlier this week. And Secretary Johnson, you have too. Of course, Dr. Fauci I've known for ever and ever. His hair was dark and I had hair when we first met. So, but I might ask this question of Dr. Fauci and anybody else like to try to go ahead. Today, as I understand it, 0 Americans have died of Ebola, even though we see headlines every day. But thousands of Americans die every year of other contagious diseases. I'm thinking of influenza especially, something that we can curtail greatly. But less than half of our population ever even gets vaccinated for the flu. Is there a disconnect here? Should the news be putting up a big chart saying 0 Ebola, 2,253 flu deaths? I mean, would that make people start paying attention?
Well, you bring up an excellent point, Senator, that when you have something that is new and when you look at what goes on in West Africa, it's rather cataclysmic. When you look at what has happened with Ebola, because of our capability, as Dr. Frieden has often described, to do the kinds of contact tracing to prevent an outbreak here, you're absolutely correct. From the standpoint of the control, we've done very well. Often we forget when you have something that year after year after year has a terrible burden of illness and disease, you kind of get used to it and you take it for granted. But I'm very glad you brought up the issue of influenza, which is an extraordinarily important disease that we face constantly, season after season after season, with always the looming threat of a pandemic. And so there are things that we can do about it. You brought up one of them. We need to make sure that everyone from 6 months of age or older gets vaccinated for influenza. We could decrease dramatically the burden of disease, death, and hospitalization for influenza. So that's not to at all diminish what needs to be done and what we're doing with Ebola, but when we do that, we shouldn't forget other important diseases in our society.
Well, and the reason I use that as an example, and I agree with you, I'm not to downplay Ebola at all, but I'm looking at, it tends to vary from state to state, sometimes almost draconian measures taken on health care workers who have come back from Liberia or a place where there's Ebola. And I realize people are trying, oftentimes people who have no medical knowledge are trying to protect everyone, and I understand that. But do we have a countervailing thing that might happen that we're going to make it more difficult to find healthcare workers who are willing to go from the United States to follow the commitments the United States government has made to help countries like Liberia?
That's one of the reasons why several of us have said it's very important to respect the healthcare workers and to develop policies that are based on fundamental science to protect them when they go, to protect them when they're there, and to respect and protect them when they return. So I take your point very, very strongly, because I feel very strongly myself, being a healthcare worker and having so many of my colleagues who've actually volunteered and now have come back and want to resume their regular lives and their duties.
Well, I think about my wife is a medical surgical nurse, and when she was working, she was sometimes with highly, highly infectious patients, and they went through all the things that now I see on television, putting on the suits and all the rest that they did. We follow these things. One last question I might ask, and anybody wants to answer it, feel free. The president requested hundreds of millions of dollars for the development and testing of an Ebola vaccine. Knowing the amount of time it takes to develop a vaccine and test it, What are we talking about in time? Anybody care to?
Sure. Well, we've, as you may have heard, have fully enrolled the phase 1 trial at the NIH that started on September the 2nd. I just reviewed the data that came in from that. It looks good. We're going to move on towards the end of this year to a phase 2/3 trial to determine efficacy. There'll be 2 trials, one that will take place in Liberia and one that will take place in Sierra Leone. The one in Liberia will be a randomized controlled trial by the NIH. The one in Sierra Leone will be what we call a step wedge trial that the CDC will be responsible for. If, in fact, this is an effective vaccine, Senator, which we hope it will, and if the infection rate remains at a high level, because that's how you get your data more quickly, we could know by the middle of 2015 whether or not we have an effective vaccine. So we're hoping that that will be the case, but we fully are now already geared to start this towards the end of this year and the very first month of 2015.
I appreciate that very much, and Chair is back.